Hey, happy Sunday, everybody. Hope everybody is doing well today. Today's video, I wanted to talk about a little bit about the science behind masks. Yesterday, I gave some examples of different kinds of masks. Of course, there's a lot more out there, but those are just some of the basics that most people see. As you can see here in St. Pete today, it is kind of a rainy, wet day. It's not as humid now, though, because the rain's passed through. It's also not as hot, which is nice, because normally you sit out here, even with a fan overhead me, and you're sweating. I mean, there's just no ifs, ands, or buts about it. So today I also wanted to give out a couple of shout outs. One was to my friend Dr. Alex Hamill. Dr. Alex Hamill is somebody I've known for a while, a very intelligent man. He's done a lot with epidemiology. He is what he calls himself, a registered biosafety professional. He's my first professional critique, so I was very happy to receive that. I was like, oh wow, this is really cool actually. He basically pointed out something that it's a mistake that I shouldn't make, but sometimes they do, and I think a lot of professionals run into this occasionally. And we just do it just out of force of habit. It's not a good habit to be in, so it's one that needs to be broken. And that's just to assume that everybody knows exactly what I'm talking about when I refer to certain terminology. In this particular instance, he pointed out something about mask versus respirators. And he said basically, and I keep looking to make sure I get this right, a mask is pretty much anything you put on your face, of course, from the terminology of infection and prevention. And basically it's just like the cloth mask. They go over your nose and mouth, things like that, but they don't form a complete solid seal. They're there to protect you from droplets from COVID because they can stop those coming at you. They also can, if you're infectious, you can also, they can stop the droplets that you expel whenever you're talking to somebody, coughing, sneezing, whatever you're doing. Respirator by definition has to form a tight seal around your nose, around your mouth area, all at the same time. And those are the ones, like the really thick ones, the N95s, N100s is the NIOSH ones. And the idea behind those is that when we go into rooms where somebody is infectious and we know they are, an example is TB, which is something else I found out I did yesterday by accident. But anyway, the idea is that they stop everything coming in and out. They filter your air in and out both. It's a complete seal. So that's something he really wanted to point out. I'm going to restart a couple of things here. Anyway, the other thing too, and I was kind of surprised nobody caught this, including Dr. Ham, which I was kind of surprised that he just passed by him, and that I rewatched my video from yesterday and I accidentally called TB a virus. I don't want to confuse anybody. It is not a virus. It is spread by droplets, but it's a bacteria, not a virus. So if any got confused by that, I apologize in advance. So one of the things I want to talk about today was a little bit of the science behind the masks and how do we know they work. And to start off with, a lot of people like to talk about how the CDC initially did not recommend masks. And there were a few reasons that the CDC gives for that. And one of those is they didn't want everybody to start running out and hoarding masks, which they did anyway. And we know that because in different clinics, hospitals, nursing homes, we just could not get a hold of any masks. And in fact, one of the clinics I know for a fact, we were having everybody just wear cloth masks. That's the providers themselves, because we just didn't have a choice. We could not get a hold of even a basic surgical mask. Everybody was hoarding them. They weren't being manufactured fast enough, and this was something that was completely unprecedented, which is another reason the industry that makes these things, really, there's no way they could have been prepared for this. It came out, and there you have it. It wasn't just here in the United States, it's worldwide. So there was your supply. It's going everywhere. Anyway, so that was one of the reasons the CDC gave. Another reason that they gave to us at the time they were given that advice, they didn't really realize, what did they say, that the early studies found that they didn't really think it was going to spread that fast. And in fact, they ended up finding out later on that not only can you be infectious 14 days prior to symptoms, that the viral load peaks in those days before the symptoms. So in other words, you're not just infectious, you're really infectious. And here you are with no mask running around spreading COVID-19. So that was some of the reasons that they gave for that. And the other thing, too, that they talked about was for countries like the United States, Europe, things like that, we really weren't prepared to tell people, hey, go out, wear a mask, because it's just not something that was culturally done here. So I'm guessing they really didn't think it was going to work that well, and some people are going to be resistant to it, which, as we know, they are. So there you go. I mean, it's more prevalent in Asian countries where people are wearing masks, and they were wearing them for years, just for basic health, just for environmental pollutants and things like that, you know. So they were used to wearing it. So here we go with some of the studies that come back, and this study actually came out of, let's see here, the University of San Francisco of Epidemiology, Dr. George Rutherford and Dr. Peter Chin Hong. And they talk about some of the studies that have been out there. There's a lot more than what they talk about that show that the masks do work. And one of the ones they pointed out came from a laboratory study of respiratory droplets and the ability of various masks to block them. And what they used was a high-speed video that found hundreds of droplets ranging in different sizes from 20 to 500 micrometers, which is, I don't know how to compare that to anything, but they were generated just by saying simple phrases, just like I'm talking right now. If I was infectious and somebody was sitting near me and they didn't have a mask on, I don't have a mask on, I'm infecting this particular individual just within a matter of seconds just by talking. But they found that nearly all the droplets were blocked just even using something as simple as a wet washcloth. And this stopped a lot of the droplets. So you think about if you have these thick, like some of the masks I showed yesterday, not even the 95 one, just the cloth, regular cloth masks, they stop a lot of those droplets, and it helps prevent the spread, not only from you, but also receiving from somebody who is infectious as well. They looked at another study of COVID-19 growth rates before and after mask mandates in different states. And they found that in areas where masks were mandated, that the COVID-19 curves dropped a lot more significantly than in areas where it was not mandated. And here in Pinellas County, we've actually started to see that. We have a mandated mask thing here for public areas, grocery stores, restaurants, things like that. And it's actually, that along with social distancing has worked really well. We're seeing a lot more of it. We're seeing it in where I work at, and the clinic where I work at, we're seeing the rates drop from our patients. They're doing a lot better now. So, and we're seeing a lot less sick employees as well too, which is very important, because if we're all sick, we can't help our patients. I mean, it's not going to happen. We can't be there, and we wouldn't want to be there because the chances are we're still infectious at that point in time. We don't want to do that. They also looked at different countries. And the different countries they looked at were cultural norms, which I mentioned earlier, such as in Asia, where masks are just a kind of a common thing. They have been for a long time. And they found that in those areas that people, COVID rates and people recovered as well too, that the COVID rates went down a lot faster than they'd have in areas, again, where there's no masks, either because of availability or because people just did not want to wear them. And that was a huge problem. The other problem we have too here in the United States is there's been, unfortunately, some just racial profiling. Asian Americans reported being harassed for wearing masks, and there's been other people in the African American community as well too that feel that they are being targeted just because they walk into a store, they're wearing a mask, and people automatically think the worst just because they want to be an idiot. And that's the only way I can put it. There's no nice way of sugarcoating that. You know, just because somebody's African American wearing a mask doesn't mean they're in there to do anything bad. Okay, they're doing something good for you and for them as well too. And I'm glad they're wearing a mask. I encourage it. But I can understand if somebody would feel that they were being targeted, they didn't want to wear a mask because of that. I fully get it, and it's a sad position to be in, and it's a silly thing for us to have to endure. But unfortunately, that's society. So that's basically it for today. Tomorrow, what I want to talk about is comparisons of masks and maybe a little more of the CDC for their change in what they used to recommend versus what they recommend now. Hope everybody's having a good day. I forgot to end my video yesterday, the way I usually end these, and that's wear a mask, wash your hands, use the hand gel. Oh, and social distancing.